Hello, everybody joining us. We are happy to see you. I'm Shannon Rudisill, the Executive Director of Early Childhood Funders Collaborative. So as y'all are coming in and we're waiting on folks to come from the waiting room, I'll just invite you to change your name, rename yourself so we know where you're from. If you would like to do that, we'd appreciate it. And we will get started shortly, just after we have a minute for folks to get in. And you should know we are recording, and you accepted that when you got in, but just in case, I want to note that. We appreciate everybody joining us on this Friday before Thanksgiving. Hope you're looking forward to some time off next week. Okay, I don't see a lot of people in the waiting room, and I think we're going to have and I think people will continue to join us as we get going. So I think we should get started. So I am Shannon Rudisill, the Executive Director of Early Childhood Funders Collaborative. We're really glad that you were able to join us today for a conversation that I personally am really excited about, even though I was in the prep calls, because we were all very interested and fascinated to hear the recent findings of Child Trends that were published by Child Trends in the New York Times about child poverty and declining, and good news on that front. But we were also, challenged to make sense of them when we know that families are still in pain and that the child tax credit didn't get renewed. And so we thought this is a great moment to have a sense-making conversation. And so we've invited some extremely smart researchers to be in dialogue with each other to help us with our sense making. And one of those is our very own ECST Steering Committee member and Senior Program Officer for Education at Heising Simons Foundation, Dr. Rebecca Gomez. And I will turn it over to Rebecca now.
Thanks, Shannon. Hi, everyone. As Shannon said, I'm Rebecca Gomez. I wish I was a senior program officer, but I'm just at the Heising Simons Foundation, and my portfolio focuses on national early childhood policy and systems building, which does include a research component, particularly research focused on policy. So applied policy research is what we tend to call it, or implementation research. And so some of these findings were, not some of them, all of them were super interesting to me from that lens. Prior to joining the foundation, I was also a researcher myself, usually focusing on state early childhood systems or professional development systems. And so, lots of stuff coming up as we think about families in the context of early learning programs and in their communities for me, as I looked at these findings. So I'm going to start by turning it over to each of our panelists and asking them to introduce themselves. And then I will take it back and sort of do a little bit of framing for today. And then we have a moderated discussion with the panelists. And then we will have substantial time towards the end, about 20 minutes at least, for you all to ask questions. So as Shannon just put in the chat now, feel free to pop your questions in at any time. And we'll take them through when we get to that portion of the session. And our panelists may, end up addressing some of your questions along the way. And so if they do, we'll just kind of filter through the chat. So I'm going to first turn it over to Dana Thompson from Child Trends to introduce herself, and then we'll go to Phil.
Thank you so much, Rebecca. It's great to be here. I'm a senior research scientist at Child Trends and one of the lead authors of the report that Shannon just mentioned. More broadly, my work examines the influence of anti-poverty policies and programs on child and family well-being, and identifies barriers to accessing effective policies and programs. I'm a developmental psychologist, so I bring a developmental child-focused approach to this work.
And good morning, everybody. I'm Phil Fisher. I'm a professor in the Graduate School of Education at Stanford University, where I'm also the founding director of the Stanford Center on Early Childhood, which just launched 2 weeks ago. And what brings me to this meeting today is that we've been in our group running a survey since the beginning of the pandemic called the RAPID Survey, which is a national survey of households with children age 5 and under. that originally started as a weekly survey, became a monthly survey, has local versions of it, as well as a separate and parallel survey of the early childhood workforce. So one of the things that we have been focusing on consistently is parents and providers reports of material hardship over the span of time since April of 2020.
Great, thank you both. And I should say that both Phil and Dana, their organizations are grantees of the Heising-Simons Foundation, and our program director, Barbara Chow, is the program officer for the Rapid EC on our team, and Child Trends has long been one of our grantees. So it's exciting to see you both together. I'm going to ask you a question a little bit later about what it was like to work together and talk with each other. But first, I just want to sort of frame up our conversation for today. And apologies if I am coughing, sneezing. I'm getting over a little bit of a cold. So apologies for that. So I think, you know, I want to sort of play a dual role here in thinking about the importance of research and different types of research, right? We've got the Child Trends research, which is sort of a point in time study, right? Where you looked at certain things at a specific point in our history. And then you've got the Rapid EC, which is our ongoing implementation, seeing what's happening in real time through ongoing surveys of specific populations. And you know, as a former researcher, but also a funder of research, I feel like it's important to think about why we want to fund all different types of research and the ways that these types of research can be in dialogue with each other, which is what we're trying to do today, as Shannon opened us up with. And so from a funder perspective, the Heising-Simons Foundation has long sort of supported different types of research in the education program, and we also actually fund lots of research on science and climate as well. But we've always sort of thought about what's the right type of research for a particular topic and how can we think about, you know, sort of conceptually, methodologically approach, and then sort of researcher bias as a part of all of that. And so as we enter the conversation today, I want to sort of put that out there to my funder colleagues that, you know, I do as sort of a value from a values-based perspective, and I have some bias here as someone who's a former researcher, think that funding different types of research is really important. And the way that we think about staging and setting up those types of research on a particular topic is really useful. The difficulty, I think, is, you know, when we see research, when we read research, particularly for lay people, do you want to essentialize it down to a point or a set of points, right? And when we often see research reported in the media, it is interpreted as a binary or a just sort of black and white set of facts. And there's often a lot more nuance. And I remember being a researcher and trying to figure out how to get like a 400-page dissertation of findings to people in a really clear and concise way, because people don't have the time to dig into it. But there's often a lot of nuance that we miss. So one of the first questions that we're going to talk about after each of Dana and Phil have a chance to talk about the studies is like, how do we see the nuance in this? How can we think about these in tandem? Where are they convergent? Where might they be divergent? And what does that mean? I think, you know, the nice thing about research is it tells us where we've been at a certain point in time. It can tell us where we are now. And when you think about some of the findings and the implications, it can help us think about where we need to go, whether that's future directions for research or different types of funding for policy and practice. And so I think as funders, we have a responsibility to really understand and use research and think about it in the most nuanced way possible. I think the last thing I'll say is, one of the things, and I'm looking at notes as I talk, so I apologize for looking away from the camera, is as I thought about the findings for both of these studies, I tried to apply a targeted universalism frame here, right? And so I think both of these studies can help us see the importance of both research sets in tandem. What are the child benefit policies that we could have that could help everybody? What were the things that helped reduce the poverty rate? What are families still experiencing in real time? how does that differ across populations? How are we tracking that on an ongoing basis? And how does that help us think about those targeted supports? So when we think about a policy and practice perspective, it was helpful for me to sort of read these sets of data from a targeted universalism frame. So we're always, at ECFC trying to keep equity, in particular racial and income equity, at the forefront. And we think about this, or at least I think about it, using that targeted universalism approach. There are things that we need as a society that are beneficial to everyone, and then there are people who will need more because of the implications of structural racism and poverty. And so I think that's another place where we could sort of really dig into the nuance for these findings if we wanted to. So with that, I will stop because I may have gone over my 5 minutes, but as you can see, I'm really excited to talk about the intersection of these things. And now I'm going to turn it back over to Dana to talk about some highlights from the report. She'll do that, then Phil will go right to you, and then we'll dig into our discussion.
Thanks. First of all, I'd just like to say that I'm super excited to be here with all of you and with Phil in particular, and very excited about the discussion to come about different types of research, the importance of different types of research, as well as kind of delving into the nuances, which is really where a lot of the important findings are. But I will start by just sharing 3 key takeaways from a report that I think will help to ground our discussion. The first is that child poverty is not the intractable problem that we once thought it was. Now, this does not at all mean that our nation's work to protect children from poverty is over. There's still around 4 million children experiencing poverty and millions more experiencing economic hardship. That said, we have learned a lot about what works to reduce child poverty, and in particular, we've learned that public policies are incredibly powerful tools that can directly impact the lives of children. So my next 2 observations are about what we need to do to continue this progress. And first, making work for all families needs to be a critical part of the solution to child poverty. A healthy economy and the availability of work are necessary and important, but parental employment alone is not sufficient to lift families out of poverty. Part of the solution must be ensuring that work actually provides the resources that families need to support their children. And we can make this happen for families with things like higher minimum wages to help families pay the bills, and provisions like accessible childcare to support stable labor market participation. And then secondly, we also need a strong safety net. That's the other critical component of the solution to child poverty. So during economic downturns and when work is unavailable or not sufficient to pay the bills, we need a safety net that ensures that all families, irrespective of race, ethnicity, or family structure, have something to rely on in times of needs. And this requires a suite of programs that together address the very different types of circumstances that families face. So we need both cash-based programs and in-kind supports. We need programs that encourage work and programs that support children whose families are out of work or face significant barriers to work. And above all, we need programs that are designed with child well-being in mind and are accessible to the children that need them. So I'm happy to, of course, answer questions specifically about the findings from the report and their implications for policy and practice. But I do want to take just a second to note that while poverty measurement is, or at least poverty measurement through these nationally representative data sets that we use is really incredibly helpful for understanding broad trends and for pointing to solutions, poverty measures are not perfect. And the broad picture that we're able to paint is made much, much richer by the type of work that Phil and the RAPID team is doing. And that's really centered on the day-to-day experiences of families. And also, remarkably, they were able to pick up where our data left off and tell us what families were experiencing during the pandemic. So a huge thanks to Phil and his team. And I'll hand it off to you, Phil.
Thank you, Dana, and thanks, Rebecca, for your opening thoughts. I really want to highlight one of the things that, Dana, that you said in terms of the conclusions that and takeaways from the report that Child Trends put out and that you authored, which is the idea that government programs actually can make a difference in terms of reducing poverty, that it's not potentially as intractable a problem as maybe we thought. And the reason I want to highlight that is that I think for many people in the aftermath of the media coverage of the report, the temptation was to conclude that child poverty is no longer a problem. And it's very clear that that's not the intention of the message, that it's not, it wasn't the goal to say poverty is no longer among young children something we need to be concerned about, but rather to highlight the efficacy of government programs. And I think one of the things that's really noteworthy about that is that our data, which has been collected more recently and on a more frequent basis, tells the same story. So I'm just going to quickly share my screen so that because I think it will help to illustrate exactly this point. These are data from our National Household Survey that show the proportion of households in a national sample starting in April of 2020 that reported that they're having at least one area of material hardship. And I also do want to make the distinction between material hardship and poverty, not the same thing. Material hardship is basically the ability to acquire basic needs, and we asked about basic needs in the areas you see above. But what you see is, I think, the ability to draw a very similar conclusion about whether government programs have potential to make a difference or not, because this is the beginning of the pandemic. You can see 1 in 3 families approximately had issues with material hardship, at least one hardship. The number went up as the first season of the pandemic kind of passed us. But what's happening here, this is around the time of the child tax credit, where the government child tax credit was being dispersed to families. And you can see that the amount of hardship diminished to 1 in 4 families. And then in terms of the most recent data that we have, that increased consumer prices have led to a resurgence in hardship levels, actually to higher levels than we observed before. My point is, these changes occurred. We don't have causal data to make these inferences, but these changes occurred in the context of the very government programs that I think Dana is alluding to that can make a difference. So I think the idea of what we can do to make a difference, and that these changes are not intractable at all, but are susceptible to change over time, both in terms of policies and in terms of external events, is really important. So that's the first thing I want to say. The second is, as has already been highlighted, that all of our data show that these issues are disproportionately affecting certain sectors of the population. And so in terms of what Rebecca mentioned around really being able to identify structural and systemic issues that are disproportionately affecting some families versus others, our data show that very clearly, including a tendency in some of our data for families in certain subgroups, Black and Latinx families, for example, that were doing better financially before the pandemic, to have a much greater likelihood to fall into poverty in the context of events like the pandemic. So I think sort of greater sensitivity there. And then lastly, I just want to say exactly what you said, Dana, which is that I don't think these solutions are unidimensional. I think we need to think about these issues in a much more systemic way. And so if parents don't have access to jobs that pay living wage, that's one piece of the puzzle. But in our childcare provider data, we see that many childcare operators are saying that they have a huge staffing shortage. There's no place for kids to go, and parents are looking for care. And the way to bring more providers into the picture by paying higher wages is something that would need to be borne by parents at present. So I think these multi-systemic kind of solutions are really needed if we're going to address these issues in an ongoing, more substantive way through policies, not just thinking about, okay, a little bit more money will make all of the difference. There needs to be attention to all of the different domains that parents and young kids exist in.
Thank you both. I appreciate those overviews and your framing of your respective studies. I think the first question that we wanted to ask you to opine on is sort of what matters most, what helps families most. And that's a really broad question, but just as we dig into that, I want to sort of repeat back to you what I heard as you were both speaking, right? One, that, child poverty is not the intractable thing that we thought that it was. We can make a difference. We've seen this. both studies sort of give us a direction there that policy is a powerful tool. Government programs do have the possibility to make a difference, and it needs to be an array of supports over time, and it's not just one thing. So there's not, as much as we in the early childhood field would like to say early learning is a silver bullet to fund that, it's probably not just that, right? We sort of know that. So bringing the most nuance and context you can to that question, how would you think about what matters most and what helps families from the data that you've been deeply invested in?
I'm happy to jump in and start. I think one of the things that our report does highlight is that both a healthy economy and the safety net contributed to this decline over time. And in terms of what that means for families, I think it's a theme that Phil was just talking about as well, that we really need this multi-pronged approach. So families need supports for addressing barriers to labor force participation. And so they need access to good jobs that pay the bills, that provide benefits, and that allow for parents to meet their family as well as their work responsibilities. So things like accessible and affordable childcare that meets parents' needs and their schedules, and that's meeting children's developmental needs as well as things like family leave, are kind of part of that suite of policies that help to address some of the barriers that families are facing. And then the other side of that, again, is the safety net policies, that we need a mix of supports for families that are facing very different situations. I think another thing that we've seen that really helps is community-based programs that build on relationships and that use that relationship to tailor supports to families' needs, and also both metaphorically and physically meet families where they are. So like Head Start embeds family service workers within early care settings and kind of establishes relationships with families over a long period of time, or over several years. And there's other very interesting, innovative community-based programs that, again, are trying to really meet families where they are and provide holistic supports, connect families with multiple resources. And I think that's incredibly powerful.
Yeah, I'll just add briefly to that. One of the things that our data really drove home for our team, and we have reported on this frequently, is the extent to which, if you want to know how children are doing in terms of their emotional well-being, you need to look no further than how well the adults in their lives are doing. When the adults are struggling, then kids subsequently, when we follow them through our survey, have a harder time. And when you want to know how adults are doing, the thing that is one of the strongest predictors is their experiences of hardship. And so I say that because I think in the world of family supports and services, income supports, I think, have been a late addition to the game. We think about how to help with mental health or how to help with substance use issues, but rarely do we think holistically about the well-being of the child embedded in the social and economic context of the family, and that we might need to start by thinking about that more. And one of the other things that I think was really driven home in our data was that it's not just about sufficiency of resources, but it's also about stability. So the pandemic has actually, I think, made everybody aware of how challenging it is to live day to day in unpredictable circumstances. And there are actually decades of neuroscience research that show the same kind of thing, that things begin to sort of fall apart, even at a biological level, when you just exist in a completely unpredictable environment. The extent to which the kind of, in addition to struggling with basic household purchases, that people don't know what's going to be happening 1 month to the next in terms of their finances or other circumstances, childcare, jobs, has introduced in our data additional prediction of distress. And so I think that's important to recognize, that programs and supports that not only help with financial sufficiency, but also with stability, and that help with other aspects of stability in people's lives, can go a long way to make a difference. And that we tend to not think about that as a sort of a central kind of framing. And we found similarly, and I'll just say this as my last data piece, that that actually when families reported that they were able, in spite of all the things going on in their families, to maintain regular daily routines, which was not easy during the pandemic, and or to experience quality time with their kids, that those things provided buffers against financial stress. So it goes both ways. The extent to which you can help to shore up the stability and predictability of the environment serves as a protective factor. The extent to which outside forces make it very difficult to create that kind of predictability has a deleterious effect on kids, sort of transmitted through parent well-being.
And I'd love, if I can, Rebecca, to follow up on Phil's point about stability. I do want to note that in our data, in the census data that was released more recently, in 2021, we are seeing these huge declines in child poverty, but that poverty measure is looking at family resources at an annual level. And so we can see that, you know, when a family receives, for instance, $6,000 in an earned income tax credit, that may come in April, but the family may have experienced 3 or 4 months of job loss and food insecurity that's not captured by the overall annual picture of adding up the supports and the resources that the family had over the year. So I do want to just kind of note and highlight Phil's point about the importance of that stability, and that even as we're seeing this decline in child poverty, it doesn't necessarily mean that we're seeing a stable decline in a range of other indicators of child well-being. So food insecurity could have spiked during 3 or 4 months during the year,
right,
while child poverty has declined over the year as a whole.
Thank you both. I mean, this point around stability for adult and child well-being, I mean, I'm struck by sort of the point, I think it was you, that we have data that when we're under stress and things are unpredictable like they were in the pandemic, people can start to break down at a cellular level, which I feel like many of us have probably experienced versions of that. All of us on this call have, you know, much more degrees of privilege than those individuals probably living in poverty and experiencing some of the most extreme hardship. But we all feel that existential stress, the trauma that we're still not recovered from the pandemic. And so if you take that and add on top racism, poverty, and any other amount of instability and oppression, you know, that's extreme trauma and extreme hardship. So I just want to sort of lift that up and maybe like sort of let that lie as something to think about across all of this. But you both talked about the degree to which stability can mitigate some of that, whether it's just a routine at home or whether it's the stability of policies. And so I want to kind of dig into that now. I'm jumping a little bit since it came up in the discussion, and since we did get a question that I think relates to this, right? And so Helene in the chat had asked, you know, what's the benefit of that annual payment, the EITC? Does it change if it's month to month? I think we saw some of this with the CTC administered monthly, right? We have some data that show that provided some stability, whatever families used it for, and they could use it for literally anything, which is fine. But can you talk a little bit about, in a context of a society where we have major elections every 2 years, our democracy is designed to be porous and interactive, and that does lead to some instability in policies, right? The CTC was there as a stimulus and it did not persist. And so can you talk about, to your point about stability and sort of the implications for both policy and practice from the data that you found, can you talk a little bit about what that means for kids and families and what you might recommend?
I mean, I'll just go first on this one. I think the structure of the CTC as a monthly payment is is a potential really powerful policy tool, because the way in which we gather information about material hardship is about whether people had difficulty in the past 30 days managing the various payments for household needs. And especially when we're talking about, you know, the kind of people who are just barely making it, I think the more regular disbursement of funds can create a greater sense of stability than a one-time lump sum payment. So in that sense, I think the sort of offsetting effects of the CTC on material hardship, which again, in our data is not, we don't have any way to look kind of causally at this, but it's important to note that the levels of hardship from the time that we started following households in April of 2020 was at its lowest during the period of time when CTC was coming to people. And similarly, I think, as you say, Rebecca, that because things are volatile beyond the pandemic, you know, when we look at what's happened with consumer prices in the last 6 to 9 months, that's an event that is not necessarily offset by I mean, it may be helped by a more regular payment, but that's another factor to sort of try to understand how to contribute, is outside things that are going to be affecting families' financial circumstances as well.
I absolutely agree with both of those points. I think I would also add that the expanded CTC was unique in terms of its addition to the old version of the CTC, in that it did reach a lot more families. It reached families in deep poverty. It reached families who had incomes that were too low or below the threshold required for filing taxes in the first place. And we learned a lot about how to reduce some of the barriers to accessing the credit. So we put out the non-filers portal. We did a lot of outreach in very specific communities. So in addition to the monthly payment providing a lot more stability, it also reached a lot more people.
The other thing that I want to note is that, and this is sort of extends beyond the specific data that we're talking about, but Dana alluded to this previously. I think that as with all messaging, like the idea that income supports are critical and primary should not lead to a kind of messaging that's like, so that's all that's needed. In fact, I think the idea that poverty might be intractable being called into question is great news from a policy perspective. But I think we also need to think about what the constellation of supports are beyond cash. And I worry that if we sort of focus and the whole discourse becomes, okay, let's stabilize and create sufficiency around income, everything will be fine. That we're not taking an advantage of the accruing knowledge about the ways that strategies, not necessarily programs, but strategies and systems alignment that help really create greater continuity in daily life for families around the additional supports they need, whether it's supports with housing, supports with healthcare, behavioral health, and other kinds of services, early childhood special education. The misalignment and disconnects in those systems make it hard for us to provide the kind of holistic supports that are needed for families. But I think the basic message needs to be that if the starting point focuses on the economic well-being of households, it is truly a starting point, and that what we need to be thinking about is also how to iteratively improve systems alignment and supports for families, so that we're not leaving people to fall between the cracks when that gets them a certain distance, but there are other things for which additional supports to do things like reduce isolation and help people connect to services could go a long way further than just a one-size-fits-all solution.
I completely agree. And I think one of the things I've been thinking a lot about is, what are the systems that children and families are interacting with that can provide that kind of holistic support and that are built on trusting relationships. And I think early childhood systems is definitely a place where families and children are already interacting and there's often trusting relationships. So that's a great place and great avenue for reaching families and having connecting them with multiple types of supports. Pediatric clinics are also a way to do that. And one of my favorite programs to talk about is, this pediatric clinic in Boston that actually embeds free tax preparation services right there in the clinic while families are waiting for their appointments. And it's not just free tax preparation services. They're also connecting families with other resources in the communities. But those, I think it's really interesting, especially as researchers thinking about funding opportunities as well, to think about what are the points at which children and families have longstanding relationships over time that can get these more holistic approaches that Phil's talking about.
Thank you both. There are so many directions to go based on your comments. And I, just to pick up on the last thing that you said, Dana, I was listening to a panel hosted by the Center for Law and Social Policy, and they hit on this sort of same idea of, where are families or parents or caregivers going already, where we can tap in to that trusted community-based place as a resource to get them either involved in grassroots organizing, to get them additional resources. I know some of my grantees are doing this and have been doing this with the ARPA dollars, right? Sort of thinking about community-based navigators to help families and providers become aware of that are available. Because as we know, the public doesn't always know what ARPA is, right, and how it impacts them, right? The government has not done an amazing job of communicating some of those resources. And so what can we as funders, researchers, advocates, organizers do to help get families the supports that they need when they are available? So I just want to sort of plus one that comment.
Can I just jump in really quickly with, because I think one of the things that is really critical, and this is a little bit of a research wonky kind of a comment, but I think really important, which is these kinds of strategies that you guys are talking about, to me, seem like low-hanging fruit. Like we should be able to start thinking about how we can extend the various contact locations like pediatric healthcare into the community and help connect people to supports in a more holistic way, just like absolutely. One of the challenges that I think the research community really needs to take on is to not fall prey to what we've done historically, which is to say, like, okay, here's a new approach. Let's get a bunch of funding and do a couple of RCTs. And now this model is the new model. Because what that does is to cast the idea of testing innovative approaches in a like out with the old, in with the new. And we end up with programs that even if they make sort of incrementally better impact, then end up just being static. They don't evolve over time. And so we need to pair sort of the way in which we're talking about the kind of really powerful and rigorous research studies that Dana's been able to do with the kind of archival and longitudinal data, with the kind of nimble approaches that Rapid has. But we also need to think about a new kind of methodology for program evaluation and for systems alignment and strategic kind of efforts. That's where the research is not about, here's a new idea, let's prove that it works, and then that'll take over. But where we can really think about this from an improvement science perspective. How do we learn from gathering information about these kinds of efforts? And how can we progressively understand who's benefiting from them, but pay very close attention to the people who are less able to benefit, and think about what are additional augmentative or creative strategies so that we get more broad response? And how do we consider that an ongoing long-term commitment to improvement and to learning about what works, as opposed to now we're thinking about systems alignment, and now we're thinking about holistic kinds of services. So we'll do that, and then that'll be the next wave of evidence-based programs, and we'll be done. The research community really has to get serious about that, and that's one of the things that we're focusing a lot on at our new center, is how to really realign what we mean by impact evaluation with kind of the reality that exists, that funders, that advocates, that policymakers can put in place, so that we can actually make progress and not just repeat the past.
I have, I want to pick up on that, but Dan, I want to make sure if you wanted to add on or amplify or disagree.
No,
Yes.
I do very much agree with that. I think, you know, we've learned a lot of as a research community, and I think part of the trick is kind of building off of what we've already learned and pulling from the ongoing research that we're doing to in ways that are not specific to one particular next model, but help inform the development of interventions more generally. I think, and you alluded to this, Rebecca, at the beginning as well, you know, we also learn a lot from a mix of different types of research. So the quantitative studies that can kind of take the broad approach and even look more nuanced at who is this working for, need to be supplemented by the qualitative studies, which really get at the why and then create new questions and new hypotheses that can be explored in additional both qualitative and quantitative studies. And I think the other thing I would add is we need more longitudinal research, because we need to be able to see, are these impacts that we think we're having, do they fade out? Do they accumulate over time and spill into other areas of child well-being? Those are all really important to understand.
Yeah, thank you both. I would just add, from a funder and former researcher perspective, again, sort of taking the hybrid lens, right? As a researcher, you're often trained to engage in knowledge production, and sometimes the ethos is the next new innovative thing, like create a new methodology, create a new evidence-based practice, and funders, you know, have often, with good intent, supported this, right? But with funding, there's often, with private philanthropy, there's often the ethos of sort of, what's the next innovation? What's the next new creative thing? How can we make our mark? Who are we supporting that is sort of the next sort of shining star? There's nothing wrong with either of these things in and of themselves, but your points, Dana and Phil, about, you know, needing to really take a step back, look at things in context, look at where people are in communities, and embed the research in that, using an implementation science approach over a long period of time, and leveraging many different conceptual frameworks or methodologies to do that, whether it's a point in time in a community, a longitudinal approach, or ongoing implementation. There's a place for all of those things here. So I really appreciate you both lifting that up.
Rebecca, you can say that you're a former researcher, although I don't believe anybody can actually be former. Once you're a researcher, you're a researcher, and clearly your insights are spot on here. So yes, 100% agree.
I appreciate that, and I appreciate you acknowledging that one can never totally retire.
That's right. That's right.
Just as I think one can never totally retire from being an educator, as well, you sort of have
absolutely
the perspectives, you have them. So we've got some questions coming in the chat. I have, you know, a bajillion more things that we could talk about, but I want to honor the folks that are here with some questions. So why don't we start with, so Kenneth, you put some great comments in the chat about just sort of the studies that exist about financially stressed individuals, ideas about embedding social workers or community workers in different places. And then I want to kind of acknowledge that comment as a part of the context of the conversation, and then go to Helene's question, and then Shannon's, and then we have one from Katie Harkin. So sort of Helene is asking, you know, from an advocacy perspective, right? We have state advocates that are telling us that there's support for CTC, EITC, but they get pushback on the administration piece. So they settle for less frequent administration. Is there anything that you can sort of give to the advocates from the data? Is there low-hanging fruit about sort of the monthly recurrence? Is it what you just talked about the stability, or would you add to that at all? About what's helpful for families and pushing back on state administrators about the frequency of those payments?
Boy, I think it's a tough question, because what we don't want to do, this is where, you know, we start having things be a little bit more on thin ice. Like our data don't show conclusively that more frequent payments, you know, are the you know, the driver of the reductions that we saw in the proportion of households reporting material hardship. So I don't think we necessarily can say at this point, like, yes, that's the solution or the antidote to some of these things. But I think that there's a lot of room to say, if there's a way to keep track of what, and I think we now have some of these methods through these kind of pulse surveys, to be able to do this on a more wide scale basis. If there are states or communities where more frequent payments become possible, either because of federal policies or because of local levies and things like that, then seeing whether more frequent payments do seem to create greater stability and greater reductions in material hardship is something that could be done over time. And given that the amount of effort in getting these kind of basic surveys up and running is not substantial, one of the things that we're doing a lot of is doing more local surveys. So we have the national rapid survey, but we also, in a number of communities which have approached us, are doing community-based, county-based. We're doing a very large state-based survey in California. With that kind of straightforward data collection, we can track these things as they're happening. So I would say, rather than say like it's a no-brainer, you know, make payments available on a monthly basis because our data show X, I think it's more like where there are places where there's potential to try innovative things. As I was saying earlier, if you compare those with data collection that's more nimble, that may not be of the gold standard variety that I think is often where we ultimately want to end up, but we can do a lot of optimization of these various approaches if we're using more kind of nimble and flexible strategies to gather information. Dana, what do you have to add?
I would just add to that in addition to nimble data collection strategies, we would love to see more nimble systems to begin with. You know, one of the recommendations of our report is the need to reduce administrative burden. And I think that there's a little bit of that on both ends of the equation. We want to reduce the administrative burden for families, but we also want to reduce the amount of red tape in the system to begin with. I think a lot of our systems are set up to kind of haul through documentation and make sure the exactly right people are receiving the benefits. But I think we probably need to shift to recognizing that there's need, and that these programs are designed for families, and we want to be able to ensure that they're getting the programs that they are eligible for.
Yeah, thank you both. I mean, those of you who know me, I never stop talking about governance, and there is a temptation in policy to design a static solution that is good for all, whether it's monthly payments or more payments, but what you're both really talking about is the adaptive capacity of government to implement policy flexibly that meets the needs of families and communities. And those may differ at different times for different subpopulations. And what's so great about the data that you both have helped produce is it collect and analyze, right, is helping us understand sort of some of those variations and what could be universal and what could be targeted and what the flexibility. Yep. So you're really, to your point, Dana, about flexible systems, in addition to sort of flexible supports, that's a governance function for states, territories, tribes, communities to carry out. And that's really hard in the system that we have right now. I'm going to move us to the next questions. We have only a few minutes left. I think you've talked a little bit about this, but the next question is sort of what are Rapid's plans to continue to track these indicators over the long term? Is this now a permanent or periodic feature of data collection? I once heard a discussion that we need a real-time economic indicator of family economic well-being, much like the stock market reported. Is Rapid the closest we've had to this? And then I would ask for you, Dana, to sort of think about what from the Child Trends report, could be integrated, or have you already thought about integrating that into ongoing studies?
I'll go quickly and go first. The Rapid survey started as a pandemic-focused survey. What we've learned is what this comment alludes to, which is it's actually a really helpful tool, I think, for understanding the well-being of whomever the focal population is. One of the reasons is because in addition to quantitative data, so we can look at proportion of households experiencing challenges, we also collect open-ended questions. And we've had in the last couple of years over 220,000 responses to those questions. So we have this massive corpus of text-based data that allows us to extract themes. And so we can go beyond just proportions or numbers to saying, these are the issues that are on the minds of people most critically. And that type of analysis actually you can do over time. So you can say, these are the themes that are coming up right now that are the biggest concerns. Other things ebb and flow. And you can also look at the themes that are coming up that vary based on demographic subgroups. So for example, in response to open-ended questions about what are the biggest challenges, when you look at middle and upper income people during the pandemic, the majority of those themes in the statements people made were about isolation, loneliness, missing extended family members, et cetera. In the low income, 200% or more below federal poverty line, we saw that the majority of comments were about basic survival, not having enough money, people getting sick and dying, not having health care. So it's a very powerful tool, I think, to kind of elevate and bear witness to the experiences of people. And I do think it's been a powerful tool for influencing policy. I think it does allow us to continue to monitor these issues across time. And as I said, I think some of our local work is particularly to us important right now, because at a local level, at county levels and at state levels, that's where a lot of decisions get made. And so being able to say, this is what members of our county are experiencing. We just did got data from a survey in the county in Michigan, where we found that 92% of the Black households report one or more material hardship right now, 92% of households with kids. And with the Latinx subgroup, it was 88%. That data needs to be made available locally, because it shows a very different picture than what we're seeing at the national level. And so I think there is a lot of potential for this kind of methodology, Rapid or other types of methods, to really contribute to the ongoing policy discussion and to continue to inform research efforts as well moving forward.
Yeah, I completely agree. One of the things that came out of our report was that there are subgroups of families, subgroups of children, and families who continue to face significant barriers to accessing economic mobility opportunities. So we saw that kids and families who face occupational segregation and discrimination, specifically Black children, Hispanic children, children in single parent families, are still 3 times as likely to experience poverty as their peers. And I think children in immigrant families are almost 2 times as likely as their peers to experience poverty. So some of the ongoing work that we're doing is really to think about the systemic barriers faced by these families and children, and how to address, how to help reduce those barriers. What are those barriers? How can we reduce them, both from a policy or from a programmatic perspective? I also love your point, Phil, about the need for data at a more local context, to be able to really understand how that context also influences child poverty and economic hardship.
My mute button didn't want to work. Sorry about that. Thank you both. I want to pause here. Acknowledge that we have just about 3 or 4 minutes left in the session. I feel like this is a great discussion that could go on. There are a few questions in the chat that we won't get to. One is about methodology. One is about representation or underrepresentation in the child trends sample. One is about the pros and cons of a supplemental poverty measure. These are all like thick, deep questions that we could chew on for a while. So I just want to acknowledge that we don't have time to do that. And what I would like to do is first say thank you to both of you for your research, for joining us today. And in closing, I would love for you to each just sort of in a few sentences, like what's the one thing you want funders in particular, since this is a group of funders you have on the line. Some of them are national funders, some of them are regional or local funders. Some of them fund early childhood specifically, some of us fund more broadly. What would you say to us with these data in mind to sort of take home as next steps, food for thought, kind of anything that you want? And I'll let you choose who wants to go first. If you want a minute to think, I can keep talking.
I'll go. Give you a little bit more time to think, Dana. A couple of things, 2 things actually. One, I think that the philanthropic funding world has a huge role to play in the transformation of the early childhood ecosystem, in the sense that so many things that need to happen in terms of innovation and new ways of thinking there needs to be a demand created. Like, I think that people in policy, I think people in program development and research are ready to see things like there's a need to renew and refresh, but government funding to test new programs, risk-taking around implementing policies that are not from so-called evidence-based kind of programs, those things are very hard to get momentum going on. And I think that the philanthropic community plays a huge role in beginning to sort of reconfigure the supply and demand equation, and the funding for not only creative thinking about what can be done, but then also for sort of going beyond just RCTs as the way to gather evidence and thinking about evidence as more incremental. Those things will contribute dramatically to the change that I think we're hoping to see happen. So to me, that's like one of the biggest takeaways here. And the other is that, again, this is probably starting to sound like a recurring theme, but I think we should be thinking about systems and about strategies and focusing on what's effective around systems alignment and around strategies that can be widely deployed, and move away from just individual programs. And that way, what we're doing is really scaling ideas as opposed to scaling things that have historically, and I think we know this will continue to occur, have really underperformed, even though they've been implemented with the best of intentions. And I say that with all due, sort of humility, because I've developed a number of such programs, and we've seen how far they've gone, and that they haven't delivered what we had hoped for. So I really want to emphasize that we should be thinking about scaling ideas and solutions and not programs.
Yeah, I building off of that point, I think that there needs to be a focus not just on the content of the program itself or the model, but the way that we design and implement that model. So taking a little bit of a step back, and specifically with respect to whether and how we can reach the families that are most in need. So one of the things that our report highlighted was that not all of our programs are reaching families in deep poverty, that we're continuing to see these persistent disparities, that some safety net programs are actually exacerbating some of these disparities. And on the other hand, we see research that highlights that poverty is particularly detrimental in early childhood. It's particularly detrimental when it's deep poverty or chronic poverty. And so with that understanding of the populations that are most impacted by poverty. I think we need to design programs specifically for those families and ensuring that they're reached by the program. So I think we have a lot of hard work to do to understand how to best reach the populations that need those programs the most. And the last thing I'd like to say is just that there's a lot of work to do around framing too, around the narrative that we set around child poverty more generally. And I think Hillary Hoynes just came out with an article about one of the reasons the US spends less on the safety net is because we're very focused on the immediate behavioral effect of these programs. And we are what's less visible to us is the returns on these investments down the road for children. And so the more that we are putting research out there that highlights those returns long-term down the road, improvements in child outcomes, that will help to frame that conversation.
Thank you both so much. This is a lot of food for thought. I encourage my funder colleagues to sort of pause before you go to your next meeting, take it in, discuss, think about it over Thanksgiving. Also take a break because rest is important. But please join me. If we were in person, we would give you a round of applause. So please join me in giving a virtual thank you, and however you would like to, via the chat, clap your hands, to Dana Thompson, Senior Research Scientist with Child Trends, and Phil Fisher, who's professor at the Graduate School of Education at Stanford and the RAPID Project Director. Thank you both so much for your time, for the good work that you're doing, and giving us lots to think about today, and really pushing our thinking in new and important ways. I appreciate you.